If you're anything like me, like learning anatomy through sports injuries, this is episode 74, and this is Lindsey Vonn, February 8th, 2026. The last video I did got copyright struck because we used video, but we're going to go frame by frame here. So we've all seen this. Her arm gets caught in the gate, and it causes her to get offline and start twisting to her right. And as she falls down, her legs are going to extend. Now, it looks like her right leg actually connects first, but the left leg is what catches the brunt of this force, all right? And she slides down the hill. She's screaming in pain, and that's not good if you're Lindsey Vonn. She just released all this information on her Instagram, and I want to go over it because the x-rays are insane. So the left leg, she had a complex tibial fracture, tibial plateau fracture, fibular head fracture, and compartment syndrome. Now remember, the left leg is the one that had a ruptured ACL. She ruptured it a week before this competition. I think it's important to note that her and her team knew the risk of competing without an ACL, and they knew that she was going to be able to compete without one and use compensatory methods. And again, they claim that the ACL had nothing to do with this crash, and they're sticking to that. So she also had a right ankle fracture, just kind of adds insult to injury there. But let's look at these x-rays because they are absolutely insane. This is an interior view of the tibia, and you can see this is a complex fracture because this is splinted all the way through. There's another one here. This is the fibular head over here, and you can see that it has a crack straight through the middle, and the tibial plateau as well. You can kind of see it better from the posterior view, which is right here, and it's cracked all the way down the middle. And this is a superior view of the tibial plateau, and it's got all these cracks that aren't supposed to be there, and that is not good. So what did they do to her? Well, they made her bionic. By her own words, she is now basically Optimus Prime. She has all of these plates and screws. There's 3 plates, 2 on each side and 1 on, I think that's the posterior side there. Screws going across the top, all like an X of screws at the top near the tibial plateau there, and screws through the tibia to make sure that it stays together. So what is going to happen? Well, they used an external fixation device to address the tibial plateau fracture, the tibial displacement, and the fibular fracture. They had to perform a fasciotomy to relieve the compartment syndrome. Now, we've talked about compartment syndrome before. It's an excess of blood in an area or a compartment and cut off blood flow and possibly lead to amputation, which they avoided here, luckily. But this is the fasciotomy. Sorry if you don't like pictures like this. There's a drainage device here. They've got stitches going across, but basically, in her own words, they filleted her leg open to relieve that pressure. While they were in there, they reconstructed the ACL, so that's good news. But she is wheelchair bound for the foreseeable future until she can transition to crutches. The recovery is about 1 year for the bone healing. She said she has no regrets and would rather go down swinging than not try at all. And I think those are good words to live by. So that is Lindsey Vonn.